Good morning, everyone. It's your vagina hero. I'm out of costume today. I'm in the clinic helping some of my patients, and I just wanted to jump on and talk about the pelvic floor. What is the pelvic floor? How do I know I have a pelvic floor issue? And why you need to come see a pelvic floor physical therapist. Okay, so this is pelvic floor 101. Okay, so I'm taking out my organs, I'm placing these aside. This is your pelvis, and when we talk about the pelvic floor, we're really talking about the bones, the joints, the muscles, and the nerves that are in your pelvis. Okay, your pelvis is made up of a couple bones. We have the ilium here, right here. See these big bones? So when you place your hands on your hips like this, you're placing your hands on your pelvic bones here, okay? So we have these bones here. They join together in the front to form pubic symphysis, your pubic symphysis joint here, okay? And then in the back, these bones come together along with your sacrum to form your sacroiliac joint, okay? And then you have your tailbone down here, which is another bone here it's fused, it's a bunch of fused bones, and they form your coccygeal joint. So there's a little bit of movement here, but not too much, okay? So these are the bones and the joints. There's also a lot of pelvic nerves that are in your pelvis, and this model doesn't show that. We won't go into great detail about the nerves and the ligaments, but let's talk about the muscles. So the muscles go from your pubic bone here, and then they sling around to your tailbone, okay? And so if you're looking at your pelvis in the mirror, you can see your pelvic floor muscles, because see, your labia are muscles, and your rectum is a muscle, okay? Right here is a muscle. So you can see them. But there's also very deep muscles that you can't see, okay? And they're deep inside of your pelvis. Again, they go from your pubic bone here all the way to your tailbone. And look, they form like a bowl or a sling. So they are supporting your pelvic organs. So this is your uterus and ovaries, your colon, and your bladder. They're like a sling. And when you're pregnant, your uterus has a baby in it, and so it's supporting the baby, okay? But when you're not pregnant, it's just supporting these organs. Okay, so in addition to supporting your organs, they're also supporting your hips, your pelvis, and your low back. So if these muscles aren't recruiting like they should, then you could have hip pain or low back pain or pelvic pain, okay? Pain with intercourse even. You could have like vulva pain, like pain right here in your vulva. Maybe tight pants don't feel good. Maybe it feels like you always have a UTI or a yeast infection, but you don't. Maybe it's kind of itchy or doesn't feel well. Feel well as it doesn't feel good. Not that it's sick. Okay, so that's our muscles. Now, they also help with bowel and bladder function. So they wrap around your clitoral hood here, they wrap around your urethra, your vagina, and your external anal sphincter. So they aid in bowel and bladder control. You know, if you want urine or feces not to come out, you have some control over that. And you can use these muscles to help stop urine and feces from coming out, or gas. Also, if if they're not working right, you could get constipation, you could get more UTIs, urinary retention, okay? So, and then pain with intercourse because it wraps around your clitoral hood. And there's also some muscles internally that could be tensed and tight, and so when they're penetrated, it doesn't feel very good. So it's similar to like our neck muscles. If somebody was to push on a knot on our neck and it was very tensed and tender, you would say, ooh, that doesn't feel good. So if you get penetrated and it hurts, it feels like when your partner is penetrating you, it feels sharp and it doesn't feel good, especially with deep penetration. It could be the muscles. It also could be the organs, but we can save that for for another talk. But hopefully this was helpful, this Pelvic Floor 101. And if you have any questions, just reach out to me. Bye.